everyone on the call. Thank you so much for joining. My name is Dr. Gauri Kulkarni, and I head the medical operations at MediBuddy. Today, we are all gathered today. It's a Tuesday afternoon. Thank you for taking time out for this session. We are going to talk about respiratory illness. This month, we've celebrated World Asthma Day. We are talking a lot this month about how do we take care of our respiratory health. And with that in mind, today we are going to specifically talk about respiratory illnesses, acute illnesses of the respiratory tract, chronic diseases of the respiratory tract, what we can do for caring for our respiratory system, and what is it that we need to know about the kind of preventive measures that we can take in terms of, say, monitoring or diagnostic measures, and also things that we can do in our lifestyle to ensure that we keep our respiratory health good. All right. So I request all of you, if you have any questions, you can always type it out in the Q&A section or the comment section, and I'll be more than happy to take it up as and when. And I'll ensure that I answer as many questions as possible. All right. So let's begin first by understanding our respiratory health in general, right? We have to understand the different types of disorders or issues that can happen with our respiratory system. The respiratory system starts right from our nose to all the way to the back of your throat, the windpipe, to our bronchi and the bronchioles, to the actual lung, right? Which is the lung parenchyma, as we say. This whole system is called the respiratory system. And naturally, affection of any part of this is what will lead to a disorder of the respiratory tract or system, right? So the first and foremost that I would want to talk about is definitely the infections part of it, right? Because that's the most common thing that happens. I'm sure all of you at some point in time have got some kind of an infection in your upper airway, be it a cold or a cough or some kind of infection in the throat or the sinuses. So all of these infections are there, which we call as the upper respiratory tract, which means infections in the upper part of the respiratory system. And of course, infections in the lower part of our system, which is the lungs, right? Now, apart from infections, we'll also talk about chronic diseases of the lungs and chronic long-term infections, that is TB, okay? So let's begin by understanding upper respiratory tract infections, right? Now, naturally, there are different organisms that can cause these infections. Very commonly it's the viruses, right? We know right from the common cold, common virus to COVID, to the influenza viruses, the H1N1, we know so many of them, right? So the viruses are the most common organisms which cause infection both in the upper and lower respiratory tract, okay? Apart from that, of course, we have the bacteria which causes severe infection, like you have the strep throat that one can get, or bacterial sinusitis, or you can have even the bacterial pneumonia, okay? The third type of organism which can cause infection is definitely the fungus, right? Very common, especially in patients who have lowered immune system, right? So immunity, if it is lowered, either because of any other infection, like a lot of people, when COVID when the pandemic was going around, a lot of times we saw fungal infections happening. That was because the immune system or the immunity of the person had gone down. Similarly, it could be with people who have chronic diseases. Say somebody who has diabetes, they may have increased risk of having fungal related respiratory illnesses. Okay, so these are the different types of organisms, and of course the infection, the severity of the infection can be mild in many cases to even life-threatening as well. It depends on, again, the state, the type of organism which is causing it, and also the state of the person and the immune state and the health status of the person who has it. Okay, now. Naturally, we have to understand that our respiratory system has been built very well, okay, which means that we have defense mechanisms to protect ourselves very well placed in our respiratory tract. So right from, the moment you breathe air from your nose, you know that there is hair in our nose, there are small cilia in the nose, right? They help to ensure that they stop the spread of infection downwards, right? We have no fighting forces to help ensure that there is no infection going down through the throat, right? So typically people say that, oh, there are tonsils, but actually tonsils are organs which actually help in protecting our respiratory system. Okay, so we have so there are many such defense barriers that the respiratory system has. Like, for example, in the lower airways, there are small, tiny cilia or like hair-like structures, which helps in ensuring that the bacteria are pushed outwards rather than, or the organisms or any kind of dirt and dust is pushed outwards rather than inwards, right? There is also presence of mucus, which helps in trapping any kind of foreign material so that it doesn't go downwards into the lungs, right? So there are a lot of these defense mechanisms, or rather protective barriers, which are present in our system to ensure that infection doesn't happen. However, despite all of that, some of us do get infections, right? So for example, the most common thing is like a common cold, right? Which with any change in the weather leads to mutation or change in the viruses, and then it can lead to very common cold. Most common pathogens, if I had to say, or the viruses would be influenza, parainfluenza, RSV, rhinovirus, adenovirus. These are very common. They're there in the environment at all times, but a few of us may get infected with it, right? So typically, common cold may cause inflammation in the nose or the sinuses, the back of the throat. People may present in with, say, headaches, discharge from the nose, congestion, sometimes a cough, right? So those are the kind of illnesses that you may, or symptoms that you may see. See, in most viral illnesses, we have to understand that they really don't need any kind of treatment as such, right? Most most viral illnesses are actually what we call as self-limiting illnesses. Okay, so when I say self-limiting, why? Because body's defense mechanism is good enough to fight against them. But in some cases, there might be need of medications which are more than the symptomatic treatment, right? Similarly, like common cold, you have, say, influenza, where the symptoms would be a little more severe, right? There could be sore throat, headaches, fever, cough, chill, so all of this can be there. And many a times, influenza can also go down into the lungs and cause pneumonia, right? So that is something that we have be poisoned off. Naturally, as I said, the treatment mechanisms for any viral illness is usually rest, lots of fluids, symptomatic medicines to relieve fever, cough, runny nose, and any other symptoms. If required, antivirals, that would depend on the severity of illness and what specific virus it is. So specifically, I wanted to mention here influenza because there are vaccines which are available, and usually it's a yearly once vaccine. And I recommend that people do take influenza vaccines or flu shots once the vaccines are updated every year. Usually we recommend it to be taken post the rainy season, somewhere around October, so that you have good cover of the for the illness during the winter months, okay, which is when the virus usually is more predominant. Okay, now naturally, apart from the viral infections, you also have other inflammations, right? There could be inflammation in the larynx, it is called laryngitis. There could be something called as bronchitis, which can be caused, which is the inflammation of the airways in lower airways, right? And all of these can be caused by any of these organisms, be it, say, virus, bacteria, or fungus, right? So typically, if it is a bronchitis, what we will see is that people would usually come with complaints of fever, there'll be chills, and there'll be severe tiredness with sore throat and a distressing cough. Now, why does the cough happen? Because the airways have narrowed down, right? Because there is inflammation. Usually the airways are like tubes, right? Bronchi are like tubes, which have a muscle layer outside, right? But when they're narrowed, okay, there is some mucus in the airway passage, and there is inflammation there, naturally there'll be cough, right? Cough is a way in which the body tries to open up the airway so that they can breathe out, right? So people with bronchitis will show a very distressing cough. Okay, so it's important that this is looked at and treated quickly. Treatment will depend on the kind of organism that is causing this inflammation. Apart from that, there could be also need for symptomatic medicines and for use of inhalers or nebulization to open up the airways quickly. Okay. One such severe organism is what we call a strep throat, very common, right? Streptococcus infections are very common in children specifically, but can happen in adults as well, where there is sudden inflammation and infection in the throat, the back of the throat. So, and it can be diagnosed very easily with a swab taken from the back of the throat. There are really severe sudden soreness in the throat, difficulty swallowing, white patches on the back of the throat, along with fever, malaise, and all other constitutional symptoms is usually what is seen. Okay, so it's important that in such cases, antibiotics are quickly started once the test is done to check for the strep throat. Okay, but it is important that it is taken care of immediately. Similarly, of course, bacterial infections of the lung, right, which is the lower airway, where we call as pneumonia. Now, you know that during COVID, you've heard of viral pneumonia, right? So pneumonia can be caused because of viruses also, by bacteria also, or by fungi also. So it's important that we understand that pneumonia is a serious illness. Typically it will present with fever, difficulty breathing, breathlessness, increase in the pulse rate, increase in the respiratory rate. There could be mucus in the cough, and sometimes if the cough is too much, there could be confusion and delirium as well in some people. So it's important to understand that specifically people who are elderly, those who have chronic illnesses, people who have been chronic smokers, or those who have chronic illnesses like, say, asthma or COPD, they are at a higher risk of having pneumonia, because naturally, infections can happen because of organisms in people who have lowered immunity, which are the risk factor, and these are the people who are at risk of getting pneumonia because of that, right? So we have to understand that the treatment of pneumonia depends on the cause, right? Typically, most commonly, it is a bacteria which causes it. So then there can be antibiotics which are given either intravenously or oral, depends on what is the state of the condition of the patient. But if it's a viral, then it would require antivirals as well. So it really, really depends on the cause, right? Now, diagnosis can be made of this depending on blood tests. There could be need for an X-ray or sometimes a CT scan as well. Okay, so that's a little bit about pneumonia. So we've now kind of understood the different types of acute illnesses that can happen, right? So there can be inflammation of the sinuses, so sinusitis, rhinitis. There could be throat infection in the throat, pharyngitis, as we say, or infection in the larynx called laryngitis, or bronchitis or pneumonia. So any of these areas, if they are infected, and these are usually acute illnesses, and because of any of the different organisms, it's important that you seek help quickly and get it treated, because in some cases it can be life-threatening as well, right? To move on to important thing about the chronic infection part, right, which is what we call as TB or tuberculosis, right? I'm sure all of you have heard of tuberculosis at some point in time, right? So it is a chronic disease where it's caused by a bacteria, okay? And its treatment usually is a long-term treatment, usually 6 to 9 months in most cases. And if it is not treated properly, then it can lead to long-term consequences. It can lead to a resistant variety of tuberculosis, and can of course lead to spread of the illness, because people can spread it from one to the other. So it's important to understand that TB is serious illness and that it should be addressed quickly, right? It should be looked at. So typically people with TB, they will present with on and off fevers, typically an evening rise of fever. There could be weight loss. There could be cough. There could be constitutional symptoms, decrease in appetite, not able to retain food. There could also be swellings or enlarged lymph nodes in and around the neck or in the axilla. This could be one of the things that is seen. And it is important that if anyone has symptoms like this, they should be investigated for tuberculosis, right? Most people get vaccinated for tuberculosis at birth, but still, when there is lower immunity, there is always a risk of getting the infection. Now, of course, there are tests which are available, apart from the Montu test. Of course, now there is gene expert test, which is done where they specifically check for presence of TB. Along with that, for lung specifically, there could be X-ray or a CT which can be done to figure out if there is any consolidation that is seen in the chest. Okay. Now, as I was, mentioning, that this is something which is which should not be neglected, right? It cannot be neglected, and hence it's important that it is investigated for quickly, right? So apart from the other tests that I mentioned, sometimes the sputum test to begin with is done because diagnostic dilemma can be there. Okay, so sometimes people will, your doctor may ask you to just do an X-ray, blood test, and some sputum test, and then if required, push you to get a gene expert test done. Okay. Naturally, the treatment, as I said, is a long drawn treatment, right? So it is not something that you can take for a couple of days and get better. Unfortunately, that's not the case. And we have to understand that if left untreated, TB can be a fatal disease, right? TB can lead to death as well. So we have to be careful to understand that this needs to be treated well. As I said, depending on the site and the extent of tuberculosis, the treatment can be anywhere between 6 to 12 months. And these are usually 4 to 5 drugs that have to be taken on a daily basis. Usually the treatment regime is in such a way that there is a shorter intensive phase and then a longer maintenance phase. Intensive phase usually lasts for 2 to 3 months, and then there's an extended maintenance phase of treatment, with lesser drugs. So it's usually 5 drugs and then 2 drugs. But again, depends on the cause and the site of tuberculosis. But it's important that you take your medication in its full course, because if you don't take it, it is going to only recur. And when it recurs, it is even more difficult because it usually comes back as a drug-resistant variety that is even more difficult to treat. Okay, so from a chronic disease perspective, we spoke about TB in respiratory illnesses. Now let us go back and think of what are the chronic diseases or chronic issues that people with lung infections have, right? So one common thing that I would want to talk about is asthma, right? I'm sure you've heard of asthma. All of you must have heard of asthma before. It's a very, if I can say, a very common illness, right? And it's a chronic illness as well. It's an illness which causes obstruction to the airflow. Okay, so what happens is in usual normal people who do not have asthma, the lumen of their airways, okay, is of a certain size, right? Now, people who have asthma, what happens is the size or the airway size reduces. Okay, and this is because of inflammation or swelling of the airways. This can also be because of the mucus release or mucus formation of the airways, and also because of tightening of the muscles around the airways, right? So all of these 3 factors lead to reduction in the the diameter or the opening of the airways, which leads to obstruction to airflow and hence the disease asthma. I hope that is easily understood, right? So that's what is asthma, and it is important that we understand that this is a chronic disease. So patients who are diagnosed with asthma, it's usually a lifelong treatment or long-term treatment that they need to be in, right? Now, usually people with asthma do have triggers. Okay, when I say trigger, it means that certain things trigger them into getting into an asthmatic attack, right? For example, pollutants in the air, right? So like dust or smoke or fumes, any mist or any perfumes or fragrances which are, or a cleaning agent, aerosols, which kind of trigger the asthma attack. It could also be things like pollen and mold or mites, or anything which is in the nature, like weed and flower and hay, things like that. It could be also animal dander, cat dander, dog dander, bird feather, sometimes bird droppings, that can also be a trigger. Certain medicines are also known to trigger asthma. For example, certain anti-inflammatory medicines or certain types of medicines for blood pressures, they're known to kind of increase symptoms of asthma. And of course, certain food allergens, right? Such as, say, wheat or egg or even nuts, for example, they can also trigger an asthma attack. So it's important that we understand now every individual may have a different trigger, right? It's not that your trigger would be, the trigger is same for everyone. So depending on one's understanding about their triggers, they may want to work around their lifestyle to ensure that they don't expose themselves to such triggers, right? Now, naturally, it's important for us to understand the symptom presentation of asthma, right? So we all know it's going to be cough and wheezing, shortness of breath. Many times people with asthma also have allergic symptoms, right? For example, sneezing or itchy or watery eyes or runny nose. This can also be a presentation for people with asthma. There's a variant of asthma which is called as cough variant asthma. In such people, the only presenting symptom is just cough. They would not have wheezing, they would not have shortness of breath, they will not have chest tightness, they'll just have cough. Sometimes that can become a diagnostic dilemma because we're not sure what it is, right? Just a chronic cough. Many times they are treated like allergies rather than as asthma, and that can be difficult for the patient. And it's important, that's why that correct diagnosis is needed, right? Now, diagnosis, of course, preliminary tests for blood and X-ray definitely is done. But the most important test that they do is naturally spirometry or lung function test and pulmonary function test, okay? Along with peak flow meter, peak flowmetry. So these are tests which are done at a diagnostic center, or your doctor will get it done when you go to the doctor to understand what is the reversibility of this illness, right? So before taking an inhaler and after taking an inhaler, they see how is the breath, or what is the maximum amount of expiration that you can do, and the doctor can then hence diagnose asthma as well from there on. Okay. See, we have to understand that in most cases, asthma is not curable. It is definitely controllable. A lot of people are absolutely off medicines just by controlling their triggers, just by controlling their exposure to triggers, and using the correct and optimal medication. Asthma can be very well controlled, right? And now, typically, medicines which a patient with asthma takes are of, say, two kinds, right? One is called as the rescue medicine. Rescue is like a medicine which they take immediately if they're feeling there's an attack coming, or one is breathless, or suddenly there is tightness of chest, or severe bout of cough. That's a rescue medicine, right? So it relieves you. And then there is, of course, a maintenance medicine, right? So maintenance is usually a medicine that is taken on a regular basis every single day to reduce the number of attacks that one would get, right? So these maintenance medicine or long-term medicine is taken to prevent, say, excess production of the mucus and to reduce the inflammation in the airways, right? So that is the role of a long-term maintenance drug, versus a rescue drug is something which will give quick relief, right? And it basically helps in relaxing the muscles around the airway to help a person breathe better. So it's more quick in action, right? So usually there'll be two inhalers or two types of medicine that are prescribed in patients with asthma, right? And it's important that you learn the right way to use an inhaler. Some people may use inhalers, some people may use rota caps, some people may not be able to use any of these and resort to using nebulizations. So it really Kind of depends on what is it that you're using, but either which ways, how to use it is more important, right? So when you go to your doctor and the doctor prescribes you something, be it inhaler, rotacap, whatever it is important that you learn the right way to uh, use it so that the medicine is optimally kind of reaching your lung the right way. Okay. A lot of people ask me when they have asthma, will I get dependent on the inhaler? It's a very common question that people ask. We have to understand that the inhalers are actually the best mode of giving medicine, because when you use an inhaler, the medicine is directly going to the lung. The medicine is not going into your bloodstream, right? Typically, if I had to eat a tablet or eat a medicine, right, it will go into my digestive tract. It will go through all through the digestive tract, get absorbed, go into the liver. The liver will then metabolize it and only then make it available for its action on the place where it is supposed to, which is the lungs, right? But when you use an inhaler, it directly goes into your lung. And because it can reach faster, naturally the response, you will see that you will start feeling better much faster when you use a direct inhalational product, right? So do not shy away from using inhalers if you have asthma. They are very good also because they are working directly on the lungs. The side effect profile of the drugs is much lesser when used in the inhalational form rather than when you are using it orally, naturally, because it is not really going into the system and affecting other organs, right? So this is important for everyone to understand. Okay. So see, it is important if you're somebody who has asthma as an illness, it is important that you identify and minimize your triggers, right? Or understand where the triggers are coming from and try to reduce your exposure to it. Because that's one single thing that can help you to feel better immediately, right? That you are not exposing yourself. But of course, it's easier said than done. It's not always, it's not easy to just get away from dust because it's everywhere, right? But if there is a specific allergen that has been found out, and then if you can minimize your exposure, it really helps in long term to reduce the number of asthma attacks. Okay. The other thing is to understand your medications and the way to use it, right? I think from a treatment measure, this is one single most important thing. If you use your medicines correctly, then most of the time you will be symptom free. Okay. And then you can go about doing your day-to-day activities very easily. The next thing is, of course, recognize your, any symptom. Like if you think that something is, you are having a sense of tightness in the chest, or if you are feeling that you are wheezy, recognize your symptoms quickly before they get worse and seek help quickly. Okay. So always have your medications in your pocket. So when I said there are two types of medicine, one is called as the rescue medicine, one is the maintenance medicine, right? The rescue medicine should always be in your pocket wherever you're going. That way you will be quickly acting upon any situation. If you see that your symptoms are worsening, suppose you were out on the road and then there is a sudden wind which brought in a lot of dust, and you're suddenly starting to cough and feel tightness in your chest. It is very important that you have this rescue medicine with you, because it will help you quickly, right? And you can move ahead, and then maybe if required, of course, go to hospital and seek help, but it will definitely help you to have the rescue medicine on yourself at all times. It is recommended by everyone to keep it on you. Okay. Now, apart from, of course, asthma, there is another illness, chronic illness, that I would want to talk about is called as COPD, or chronic obstructive pulmonary disease. Okay, it's again a very common disease, specifically seen in older age groups, in people who have been chronic smokers. COPD is a common disease. It basically means that your airways are chronically obstructed, right? Where the airway diameter is reduced so much that the air is not flowing. So such individuals will show chronic cough, again, tightness of chest, breathlessness, and it is an illness which progressively worsens as one grows old. Also, people who have COPD tend to fall sick more because their immunity is low, so they tend to have multiple infections, including pneumonia and things like that, making it even more difficult for them. Now, with COPD, also there are medications initially available, like inhalers, how they are available for asthma. But as the obstruction increases, most individuals would require oxygen at some point in time. Okay, so it's important for us to understand that it's one of those illnesses which are difficult to live with. And that's why I recommend people, especially if you are smoking, please try and give up on smoking, because over a period of time it will affect your lungs and may even lead to COPD, which can be a difficult disease to take care of, right? And hence it's important that people who have chronic lung diseases like COPD and asthma, we usually recommend them to take their vaccines correctly. So one is the flu vaccine that we spoke about, and another vaccine which is available is called the pneumococcal vaccine. Pneumococcal vaccine is against a particular bacteria called pneumococcus, which causes very severe form of lung infection, which causes severe form of pneumonia, and it can be life-threatening as well. So individuals who have chronic diseases, comorbidities in the older age group, they are definitely recommended to take the pneumococcal vaccine also. So if you are somebody who has COPD, if you're someone who is above the age of 60, it's a good idea that you seek for pneumococcal vaccine as well. Flu shot should be taken on an annual basis. Please do take it as well. These two vaccines will definitely help you in the long run to keep your respiratory health better. Okay. Now, of course, we need to also talk about, in short, about another illness. I'm not sure how many of you know, and this is also associated with smoking, and hence I'm clubbing it with COPD. It's called emphysema. Okay, emphysema is basically destruction of the lung parenchyma, or destruction of the lung tissue itself, right? And it is also associated with smoking. Okay, and people who have emphysema over a period of time, basically the lung is unable to take in enough oxygen, right? So because the lung tissue itself is damaged, so the exchange of oxygen and carbon dioxide doesn't happen well in such patients, right? As I said, that cigarette smoking is one of the most common reasons for people to develop emphysema as well. And what it does basically is that it destroys the lung tissue itself. And because of the chronic irritation and inflammation that the smoke causes, the airways also gets diseased, in patients with emphysema. So hence it's also important. And these patients also over a period of time would require oxygen therapy at some point in time. Of course, nowadays there is a lot of lung transplants that are happening with patients with very severe COPD and emphysema. And of course, that is something that can be thought of as a treatment, but of course, it is not very easy to go through a lung transplant, right? Now, okay, before I go ahead, let me just quickly look at the questions, because I had some, I had to talk about the lung cancers as well, but I thought I'll take the questions. So there's one question which calls about, can pleurisy repeat after a particular period of time? Okay, so that's a fantastic question. Let me first tell you what is pleurisy. Okay, now pleura, okay, is basically like a covering of the lung. It's like a sheet which covers the lung. Okay, and pleurisy is basically inflammation of the covering of the lung. Okay, that's what it is. Okay, and usually pleurisy is seen in people who have had pneumonia in the past, right? So when they had pneumonia, that pneumonia also affected the lung covering, and hence the pleura, and hence the inflammation of the pleura leading to pleurisy. Okay, that's the most common reason I can say. Now the problem with pleurisy is that yes, if the inflammation or the primary lung condition hasn't resolved well. Now, it can be pneumonia. It can also be a chronic lung, chronic lung disease, which can lead to repeated irritation of the pleura if that is happening. Like, for example, in TB, it's a very common thing to have pleurisy, right? So if those are the cases, then yes, pleurisy tends to kind of keep happening or keep repeating. That's a possibility. So it's important that if you're having repeated episodes of irritable pleura and inflammation of the pleura, you should get it checked as to why it is happening. Okay, because it can also be very difficult. People who have pleurisy tend to it can give a very bad chest pain as well. The pleuritic chest pain can be very, very severe, and at times it can even mimic heart illness. Okay, and it usually makes it difficult for a person to breathe because the pain is there, so one doesn't breathe fully. So people who have pleuritic chest pain also tend to have very shallow breathing. Okay, because the pain increases or worsens when they breathe. So yes, it's very much possible that pleurisy repeats. Get yourself checked as to find out what was the reason for the pleurisy to happen in the first time, right? And maybe that will help us to know if there could be some chronic ailment that is sitting underneath, which is causing the repeated inflammation of the pleura. Okay. There's a question which says, I have no smell since a long time, how to recover? It's great. A lot of people had that problem, right? So where during COVID, we had individuals who lost their sense of smell. Most people's sense of smell comes back, okay, if there is because of an infection. Okay. In cases where it doesn't come back, there is actually there's something called as olfactory training, okay, that can happen. So if you go to an ENT, they will refer you to specific people who will do what is called as a olfactory retraining. Olfactory means smell sensation. Retraining means exposing you to very strong smells to make you understand what the smell is again. It's like training your brain again to understand what are the different types of smells. However, before that, it's a good idea to find out why it is not coming. So typically smell sensation, if it is not there, there can be a couple of reasons also. One is, of course, infections, chronic infections, which have happened in the past. But sometimes if there is poor availability of the cilia or the small hair in the back of the nose, that can lead to lack of sense of smell. It could also be, chronic use of nasal drops has been one of the reasons for loss of smell. Loss of smell can also be because of nerve-related problems. So we are not sure why it is happening. I have taken it as the most common cause is post-COVID or post-viral infection. If it is so, usually it recovers. If it is not recovering, you need to go through olfactory retraining. You do need to go to an ENT specialist and they will help you out with that. But before that, they will definitely try and find out why the sense of smell is gone. Is there any other reason for it? Okay. There is a question here. I'm just trying to read it out. My father is suffering from COPD for last 3 years and it got severe now. I'm so sorry for that. Nowadays, when he's sitting idle, he was able to manage without oxygen concentrated machine. But when he goes to toilet, it is there's a lot of exertion. Even with the machine, he cannot manage. I'm really sorry. I know COPD can be a really difficult illness, and especially as a caregiver, seeing your father suffering and going through so much strain, I'm sure it must be very difficult for you as well. However, COPD is one of those illnesses which are progressive in nature, which means they do, over a period of time, the deterioration is very evident. Okay. Now, if you see that even with small amount of exertion, there is breathlessness, okay, then we need to cut down on the exertion, which means that if he is not able to walk to the toilet, maybe we need to get a toilet seat or figure out methods in which he's not exerting himself. Okay. The second thing can be we can increase a little bit of the oxygen concentrator maybe if he is on 2 liters per minute, maybe you can up it to 3 liters, or up to 5 liters. But I'm not sure how much of oxygen is currently, he's using, right? But it's a difficult phase to accept as well. But, because this is going to be worsening, you need to reduce the amount of effort that he needs to put in, right? Secondly, of course, look at the medication, right? Is there any medication that can be given? I'm not sure if the doctor has put him on some kind of nebulization to open up his airways. That may help. Sometimes doing a nebulization before he goes for his morning ablution. Say, suppose he needs to pass his motion, doing the nebulization just before that may open up his airways to some extent, to help him to be able to go through with his regular routine, right? But the focus should be on reducing the exertion and the events that are associated with it as much as possible, right? So there's another question on COPD. My mother is having COPD and she's continuously taking inhalers like Furacort and Tioba. Very good. Is it okay to sometimes stop these inhalers when it feels like it is not so much required? And then again, can it be taken based on the requirement? Very good question. See, as I said, right, COPD is a chronic disease. It's a chronic worsening disease. Inhalers that you take will basically help in keeping the airways open. Okay. Now, it really depends on the symptom profile. My recommendation is usually not to stop in the case of COPD, not to stop your medicines in the case of COPD, because the airways are kept open. And because the airways are open, the breathing is better. Because breathing is better, the whole bodily system is working better, right? There is enough oxygen for other systems to work. The moment you stop inhalers, right, over a period of time, in a couple of days, you will see that one is slowing down, one is inactive, one is finding it difficult to do basic activities. So, at the cost of sounding, why should we take so much medicine? But in COPD, sometimes it is required that you take medicines. Let me add a caveat here, and which I forgot to tell before. Anyone who is using an inhaler, right? Now, inhalers, as I said, there can be 2 types of inhalers. One could be a rescue, maintenance, whatever you're using. It's a recommendation that every time you use an inhaler or a rota cap or anything, right? It's important that you rinse your mouth after you have used it. Why do you need to do that? Because the particle or the aerosol or the particulate matter can stay in your mouth. And many a times, because the maintenance drugs that are there may have a small quantity of steroid, which can stay in your mouth and can lead to mild infections or a fungal infection in your mouth. It is important that you rinse your mouth and spit out when you're using any form of inhaler or nebulizer or anything that you're using. All right. But to answer your question, my suggestion is to not stop medication. If your mother is actually doing well with the medicines, you should continue with the same, right? So there is a question which says, my father, 67-year-old, is suffering from COPD for last 3 years. Nowadays, it got severe now. When he goes to toilet, it is very obsessive exertion, even with concentrator. When he's sitting, he will manage without oxygen. Okay. So I think I've answered this question already, but the question here is, do we need to get him vaccinated? Yes, you need to get him vaccinated. 2 vaccines that you will give him. One is the annual influenza or the flu shots. You have to give it every year. Apart from that, you need to give 1 dose of pneumococcal vaccine. It's a pneumococcal 13 variant vaccine that you should give him. 1 dose is enough. He's 67 years old, so you can give him 1 dose. I think that should be enough. But please do get him vaccinated. It will help to reduce his risk of getting severe infections. So there's a question that says, I have allergic rhinitis for a long time. I'm continuously taking anti-allergens for it. What else I can do to solve this problem? Fantastic question. Now, allergic rhinitis is basically, allergies leading to inflammation of your nasal mucosa. So you may have runny nose, sometimes itchy throat or back of the throat, watery eyes as well at sometimes, right? Now, what happens is that these symptoms are because of an allergen, right? So it could be, say, pollen or dust or something. And again, because it is allergy, the only way that when I say allergic, it means that, what do you mean by allergy, right? It's in an external allergen is there, and it is your body's reaction to it, right? So body is unduly hyperreactive to an external agent or some foreign material, right? So when you take an anti-allergen, what it does is it basically reduces the body's response to this external agent. Okay. Usually with allergies, there is no specific cure. Okay. However, if you have allergic rhinitis or any allergic manifestation, sometimes it's a good idea to undergo an allergen test to find out exactly what you're allergic to. Like, for example, if you are specifically allergic to dog dander, suppose I'm giving an example, then you know that you cannot be around dogs, right? Or if you're specifically allergic to, say, egg, then you know that you should not be eating it, right? So many patients with allergy, it's a good idea, to find out what you're allergic to so that you can you can stop or you can avoid those triggers. Second is definitely take anti-allergens as and when if the symptoms are worsening. Third is a good idea to look at your lifestyle. Many a times we've seen that people who have allergies tend to improve if their vitamin levels are normal, if their health condition is better. So get your hemoglobin check, basic things like hemoglobin, vitamins, vitamin D, B12, folic acid, calcium, iron. You can check these and see if you have any deficiencies. Then it's get it corrected, because that can also be associated, your body is not able to cope with the allergen as well or react to it, right? In specific allergic conditions, now there are immunoglobulins which are available. There are specific allergy clinics which are there, or specialists which are there, where they give like a specific antidote can be given. But in most cases, it is not very recommended unless specific tests are done, for which you have to go to a allergy clinic and then talk to them. But if you find out what your trigger is, try to avoid it. Take anti-allergens as and when. Take care of your lifestyle. Most of the time, you will be able to kind of manage your allergic condition. All right. Okay, there's a lot of questions. Let me quickly take one by one. I had an operation. There was blood stored in my lungs. So can I join the gym in AB? I'm not sure I understand this, but what I understand is basically you had blood in the lungs, which means most probably it was a hemorrhagic lung effusion, which is definitely a serious problem. I'm not sure when this happened, right? Usually with such an infection or such an issue, it would take recovery time of anywhere between 3 to 6 months, right? So my suggestion to you would be that, I'm not sure when your operation has happened, but go to your doctor first, get yourself examined first, the doctor may ask you to repeat an X-ray or a CT to look at what is the current condition. If everything is all right, then I don't think there should be an issue with going to the gym. But my suggestion is to go and talk to your doctor, because we don't have enough information here about when the surgery happened, what exactly was the diagnosis there, right? But usually with any kind of open surgeries, it takes about 3 months, minimum, before you can do any strenuous activity. Okay. There is a question on sleep apnea. Sleep apnea is also respiratory disease, difference from other respiratory. Okay, sleep apnea is a webinar in its own. It's a long drawn discussion that we can have. Now, sleep apnea is actually a metabolic disorder. It's not just about respiratory system, right? So what happens in sleep apnea is because of lax muscles in the neck. Um, when one sleeps, there is obstruction to the way the airflow happens, and hence most people who have sleep apnea tend to snore. A usual profile is that they are usually um, on the overweight category. They tend to sleep with their mouth open, and they tend to have apneic spells in which they will have small periods in their during their sleep where they are not able to breathe. There is no oxygen going in, right, or no air going in. So it is quite a serious problem to have, right? And it's important that this is diagnosed with what we call as a sleep study to understand how many times that the person was not absolutely not breathing. It's called apneic spells, and this needs to be corrected. Okay, sleep apnea is usually associated with high blood pressures. It is associated with cholesterol problems, so it's a very serious problem. Okay, it usually is treated by use of specific machines, right, which are basically helping in a positive pressure that is created when it is put on your mouth so that breathing happens normally. It is important that individuals who have sleep apnea, as because many of them may be overweight or obese, it is first advice is definitely given for them to try and lose weight, apart from the other CPAP machines that they will be given during night to wear and sleep so that they can breathe better when they are sleeping. Okay. Why in the winters when we go out in the evenings, nose gets blocked and results in a shortness of breath? What is the remedy of such a situation? Yes, in winters that is a possibility because the blocked nose can be because of multiple reasons. One could be just the dryness, as opposed to our understanding that usually there is mucus which leads to blocked nose. A dry nose can also give a sense of blocked nose. Okay. And the most important thing that you need to do is ensure that you keep yourself warm, wear warm clothes, sip on warm fluids, ensure that you are keeping your airways moist and clean. If that is done, then most of the times you will not have a shortness of breath or any kind of nose block issues. If you continue to have it, you may benefit from some saline nasal drops, which saline, I mentioned it, saline nasal drops, which will keep your nose or nasal passage moist so that you are able to breathe better. Okay. So there's a question, if a smoker leaves the habit, is there a period, say X number of years, that would help to neutralize the damage, if not 100%? Well, it's a very important question. I'm happy that you've been open about it and asking it upfront. I think somebody who asked this question, I would congratulate you that you have already gone into a phase where you're thinking about, not smoking or quitting, or somebody else that has thought about it. So it's important for us to understand that once you start smoking, the effect of smoking does live with us for a very, very long time. Now, the period which, as you asked, to neutralize the damage depends on the amount of smoking that you've done and the years of smoking you've done, right? So if you've been smoking for, say, the last 10 years, then, well, your chance that, you will not have any damage is very, very low, right? There will always be damage. And it's not just about respiratory health. Smoking can lead to any form of cancer in the body, right? Everywhere. So if you, but that doesn't mean that you should not stop smoking, right? Smoking can lead to heart ailments, it affects kidneys, it affects the reproductive system, it affects the cerebrovascular circulation, which is the brain, it affects the brain. So a lot of things, right? Smoking is one thing that I would say, even if you've been smoking forever, it's always a good idea to stop it. Because the moment you stop it, it will help in some or the other way. It may not lead to neutralizing of all the damage it can do, but it will at least help in better blood circulation. It will help in better breathing over a period of time, right? The effect on the possibility of cancer is actually very, very high. If you have smoken, you've been smoking for a very long time, like more than 10 years, then it's a very high likelihood that one may have it. But things like blood circulation can improve very well. Or problems with the gastrointestinal tract can improve very quickly if you stop smoking at any point in time. Okay. Sinusitis and hay fever. Yes, sinusitis is a very common problem. Most people will present with fever and headache or heaviness in the head. And acute sinusitis is usually due to a bacterial infection and needs to be treated with antibiotics, typically for anywhere between 7 to 14 days as well. It is usually something that stays with you for it can get very easily cured if it's only because of a bacterial illness. But some people do develop what is called as chronic sinusitis, which means that sinuses are chronically inflamed. It may not be because of an infection, but it's just because of inflammation, right? In such cases, they may have chronic headaches, chronic runny nose, and they may require some surgery as well in case of chronic illnesses. But otherwise, it may, in acute illnesses, if properly treated, it doesn't, it is not something that you need to be worried about. Okay. You asked about hay fever, right? So it is basically allergic. We spoke about allergic manifestations, right? Allergic rhinitis. Hay fever is like, is basically allergic rhinitis where, you will have runny nose, itchy throat, sneezing, itchy eyes, sometimes like headache, right? So typically it is because of some kind of an allergen that one is exposed to, or maybe one is not very comfortable with. Commonly like pollen or dust or mite, these are, or cat dander. Those are the things which cause fur, stuff like that. As I said, it can make one feel it's quite annoying to have hay fever actually, and it's important that you figure out what is the trigger. Number one, try to prevent it, and also sometimes you're doing a allergy test to find out if there is a specific allergen. And then if required, in very, very severe cases, there are immunoglobulin therapies, which can be given. They are new, but you need to go to a specific allergy specialist or an allergy clinic for it. Okay. So there's a question which says, for nasal polyps, is operation the only solution? In most cases, if nasal polyp is causing obstruction to breathing, or it is causing severe congestion, or like a sense of heaviness in the nose, then yes, and it's a very simple surgery. It's better to remove it rather than it causing severe congestion and the feeling of blocked nose at all times. Yeah. Sometimes nasal polyps increase in size because of allergic symptoms as well. So if there is a concomitant allergic manifestation, allergies, then you may have to first go and get that treated, allergies treated, and see if the nasal polyp size reduces to some extent, but usually it doesn't. It usually, has to be operated only. Does the inhalers have side effect of tongue being tasteless? Yeah, that's what I was mentioning before, right? Good question. That, it's important that if you're using any inhaler for, say, asthma, COPD, any chronic disease, it's important that you always do gargle your mouth very, very nicely after every usage, because it does affect the tongue, and the steroid, if it is staying in the mouth for a long period of time, can cause mild fungal infections in the on the tongue and in the mouth, right? I'm going to take a couple of more questions. I know that we are already running out of time, but I may not be able to answer all of them. I'll try my best. Okay. So there's a question which says, sometimes my wife feels breathlessness, but after some time she regains her breath. Well, there could be multiple reasons for feeling breathlessness, right? Apart from the respiratory illnesses that we spoke of, right? Breathlessness is a common symptom of anemia, right? So if hemoglobin is low, Some people can feel breathless. If vitamins are low, that can also be a symptom. If a person is anxious, can also feel breathless, right? So it's a good idea for you to approach this breathlessness more holistically. So my suggestion to you would be that maybe get a health check done. Look at, say, basic blood parameters, look at an X-ray, ECG, and then you see if there is something else which is causing the breathlessness and not just the lungs. We are not sure about it, but it needs to be looked at. Okay. So there's a question which says, I have bronchitis issues in 6 months. I'm getting pain in the right side of the throat while swallowing frequently. Is the throat pain because of bronchitis? How do I recover? Well, bronchitis is usually lower airway, right? And bronchitis will present with cough, basically, right? Distressing cough. So if you have a pain in the side of your throat, like while swallowing, it could be something else as well. It could be inflammation in the back of the throat or the tonsils. My suggestion to you is that you get it looked at, right? Get it checked. It may not be associated with the bronchitis, right? So if you get it checked, then you will know what it is. And once we know what it is, we can actually treat it so that you can get, you can recover from it. Okay. So please get it checked once with your local doctor. Okay. I'll take one more question before we close the session. My mom is getting cough and phlegm whenever she's having cold foods, and is had COVID couple of years back. Now, when we approached the doctor said 50% of lungs got damaged by her X-ray. Is it life risk? Okay. One thing is there. If she has got cough and phlegm when she's having cold food, it is most probably that she's allergic, right? So best is to avoid it. Okay, avoid cold, eating cold items. Okay, if she doesn't have cold, cough and phlegm otherwise, okay, then we don't need to be worried about. Okay, now when the doctor says that 50% of lungs is damaged on her X-ray, I think it's also important that you should do a couple more tests. Do the lung function test. See what kind of damage it is, right? Ask your doctor what is the meaning of that damage. Okay. Usually, people can survive with just one lung as well. It's not that we have to be worried too much, but it's an important thing to find out what kind of damage it is. Is it so? My recommendation to you is that you go get a lung function test or a spirometry test done for her, so that you know what is the breathing pattern and what kind of lung damages can be found out better on a CT. If you do these two tests, it will help you to understand exactly what the problem is. X-ray sometimes may not give you that. Okay. So if you do this, maybe the doctor who is treating you can give you more more information. Okay, great. So I know that I have not been able to take up all questions, and but I know that we are also running short of time. But it's good that I see a lot of you having questions about your respiratory health. Please understand that lungs are our portal of entry for our oxygen to reach, so that all our organs can function well. So you need to protect your lungs, right? Ensure that you vaccinate yourselves correctly. Ensure that you do breathing exercises regularly to take care of your respiratory health. Ensure that you keep active. When you keep active, you breathe better, and that also keeps your respiratory health well. Eating right, getting good sunlight exposure, sleeping well, drinking lots of water are all parts of keeping not just your lifestyle better, but also your respiratory health better, right? So take care of yourself. We will continue to have more and more discussions going ahead. But until next time, it's Dr. Gauri signing off. Take care of yourself. Stay safe, stay healthy, keep smiling, and breathe easy.